The Liberals have quietly expanded the pandemic-borne federal vaccine injury support program in Budget 2024, highlighting that Canada just might have a vaccine injury support problem. Tamara Ugolini here with Rebel News to cross-reference what Budget 2024 stipulates for the Pandemic-Borne Vaccine Injury Support Program, also called VISP, versus what our exclusive access to information documents detailing the program originally stated. Now, the VISP program, which the Public Health Agency of Canada runs, was first announced in line with the emergency use authorization of the rushed-to-market novel COVID-19 shots.
The challenge that we have now is that increasingly misinformation and disinformation is carrying people to believe things that are untrue. And vaccinations is a perfect example of it.
The agency hired the private consultancy firm Raymond Shabbat Grant Thornton to administer the program, which receives approximately 60% of the budget allocated to the program, to the tune of tens of millions of taxpayer dollars, leaving the actual victims of the safe and effective regime high and dry. See, originally the total budget allocated was just over $32 million. See where it shows there that the consultancy firm was to get $20.3 million, while the victims got a measly $20 million.
I really want to encourage all Canadians. I'm going to be going and getting my own vaccination tomorrow, and I think it's incredibly important that everybody gets this. This isn't a partisan issue. It is a miracle of science that we were able to find the vaccines that have saved tens of millions of lives across the planet, including hundreds and hundreds of thousands of lives here in Canada.
Anyway, it turns out that the program was originally scheduled to run until 2026, and yet the VISP program has already paid out only a fraction of the injuries submitted, but this cost a whopping $11 million. So they've nearly maxed out their anticipated budget just over halfway through the program. Now let's contrast this with what the original budget allowance stipulated versus how much Budget 2024 has expanded the program. In the original budget allocation, fiscal year 2024-25 was supposed to receive just over $5.5 million. In 2025-26, just under $5 million. But in budget 2024, the VISP program is expanded nearly threefold in 2024-2025 fiscal year to $19 million, and the same for 2025-26 to $17 million, which totals $36 million for those 2 years. If you recall, the original budget allocation over the proposed 5-year span was just over $32 million. So the feds are now paying out more than that in the 2 final years of the program, putting them way over budget. And that's if Canadians can even get their injuries documented. Many have been refused. Those suffering debilitating neurological injuries can't siphon through the mountains of paperwork and the bloated bureaucracy to even have their injury approved.
All I could see was that my face was dropping and just the one side. Okay. My mom had a stroke when I was young, so I was familiar with what it looked like. And that's immediately what I thought was happening.
So what did they say when you got there?
They said they believed that it was Bell's palsy.
The program itself is already overwhelmed, with applicants waiting a year to be assigned to a case manager, and doctors can't get injuries approved by their medical officer of health to continue through the Canadian multi-layering vaccine injury approval process. This is proven by VISP's own statistics. They've received 2,233 claims. Of those, a minuscule 138 have been approved by the hand-picked VISP Medical Review Board. How's that for safe and effective?
And we're not talking about, and I was never talking about people who are hesitant towards a vaccine, but trying to be reasonable about it and trying to stay safe. My point was that there are people who are deliberately trying to stir up hate and intolerance and misinformation, and we do need to call out those folks.
For Rebel News, I'm Tamara Ugolini. If you would like to stay up to date on the fallout of the safe and effective narrative, you can do so at nomoreshots.ca. At that website, please consider donating to support these kinds of investigations and also sign our petition geared toward Federal Minister of Health Mark Holland, calling on him to revoke market authorization for these shots. All of that and more at nomoreshots.ca.